Hospitals across our region could run out of beds as COVID-19 spreads. WCPO 9 News reporter Courtney Francisco tells us how many beds are available and why it might not be enough.
When other regions run out of hospital beds, doctors say they have to turn people away who need life-saving treatment. So I gathered the data to find out how stressed our system could be, from Southeast Ohio to my backyard in northern Kentucky. We hear it on TV nightly.
We are battling for the health and even the lives of our parents and our grandparents.
Our governors repeat, stay at home to slow the pandemic.
We know what's coming because we've tracked what's happened in other states.
Ohio anticipates running out of hospital beds for COVID-19 patients who need treatment or intensive care. So the state health director says it's time to build temporary hospitals.
You'll hear more in the news in the days to come about hotels and even dorm rooms being turned into hospital units.
Out of 18 major hospitals in Southwest Ohio, northern Kentucky, and a portion of Indiana, there are currently 4,206 beds, according to the American Hospital Directory. Ohio's health director says they are 60% full now. That leaves less than 1,700 vacant hospital beds.
On average, we're needing our hospitals to increase that capacity by 50%.
Kentucky put a stop to elective procedures to free up some beds as well as protective materials such as gloves and masks. Harvard researchers say if we follow social distancing and stay-at-home orders, we could slow the virus to a 20% infection rate. In that scenario, more than 13,000 people in Ohio and Kentucky will likely need a hospital bed over the next 18 months. But that's the best-case scenario. If people don't social distance, the hospitals could be out of space, and that could cost people their lives.
And don't be so callous as to intentionally go to something and expose yourself to something that can kill other people.
The Harvard study is interesting because it shows the amount of people who could need hospital beds in the best, moderate, and worst case scenarios. I put that on our website as well as an interactive graph you can look at, WCPO.com. Just click on this story. Reporting in Covington, Courtney Francisco, WCPO 9 News.